Welcome back to our Dental Spotlight. I'm Dr. Sharma from Provident Dentistry.
Hi, I'm Renae. I'm a hygienist at Provident Dentistry at Canton Park.
Today we're going to talk about extraction, which is also called as pulling your tooth.
Yes.
So there are a number of reasons why we get our teeth pulled. Most common ones are wisdom teeth removal, extractions for at the time of braces or orthodontic requirements, large cavities, a broken down tooth that's broken really bad close to the gum that we can't restore, or if there's any history of trauma, which is really bad that we can't rescue the tooth.
Right. Extractions may sound scary, but in today's modern dentistry, there's really nothing to be fearful of. In addition to a local anesthetic where we ensure the area is completely numb, we also have some relaxation options like nitrous oxide or laughing gas. We could also do oral sedation, which will require a driver, but we will make sure you're totally comfortable.
So Renae, did you ever have an extraction done?
I did. I had 2 of my lower wisdom teeth out and it was pretty uneventful, easy. How about you?
Oh yes, I had retained baby teeth.
Okay.
And so I had those extracted. Those were easy.
Yeah. Yep.
Let's go over some post-op instructions after an extraction. So after you get your tooth pulled, you will expect some bleeding.
Mm-hmm.
So bleeding can be stopped by applying pressure. Usually we, as a dentist, will place a gauze and ask you to bite on it, and that's applying pressure on a bleeding site. It's normal to have bleeding for a few hours, but it should reduce, not go in big spurts. If you feel that your mouth is full of blood, it's a little bit of blood with more saliva, so don't worry about that.
It's normal to have some discomfort after having a tooth extracted, and oftentimes the most discomfort can appear on the 3rd day, so don't be worried if it increases on that 3rd day. Make sure you're taking your pain medication as directed by the office, not on an empty stomach, and if you experience swelling, use some form of ice, like an ice pack or even a frozen vegetable bag.
Right. Let's talk about some mouth care.
Mm-hmm.
So make sure you don't rinse, swish, or spit really hard after you get extraction. The main thing is that we don't want to dislodge a clot that's forming on the area where you got your extractions done. You can brush, you can floss, but avoid the surgical site because you can trigger or dislodge the clot and trigger some more bleeding. So you can do those. Don't eat or drink something too hot. Just lukewarm is good. Yep. And that's good.
Yep, which leads us to diet. So make sure you're eating soft foods, get good nutrition, plenty of fluids, but again, not through a straw. That's important.
Yeah. So infection, if there's a swelling or discomfort gets worse on the 4th day following surgery, along with the bad taste, fever, difficulty in swallowing, call the office right away. We may have to put you on some antibiotics.
So let's recap with some commonly asked questions about after extractions.
A lot of time patient asks for, how long does the site bleed for?
So usually the site will bleed for about 2 hours, and as time goes on, the bleeding should get lighter, and that can continue up to 24 hours, but you want to make sure that the bleeding is getting lighter. If it's not, give our office a call. Another question is, how long do I keep the gauze in?
Right, so the gauze, we say keep it for 45 minutes to an hour. Again, depending on the bleeding, the amount of pressure that you place will reduce the bleeding. So keep it for 45 minutes to an hour and take it out.
Yes.
What if there's swelling?
So if there's swelling, usually with wisdom teeth, we will send you home with an ice pack that you'll use on and off. With a regular extraction, routine extraction, generally you won't need ice, but if you do notice swelling when you get home, be sure to apply an ice pack, or some frozen vegetables will work also. Another one, how long do I have to wait before I can smoke?
Well, usually we say wait 24 to 48 hours. 48 hours is better. Even better is try quit smoking.
Yeah, yep.
Because anything that you do a suction motion, like straws, or when you suck for a cigarette, it can dislodge your clot. And once that's dislodged, it causes a dry socket, which is a very painful condition.
Yep.
Then another question is, can I drink coffee?
Yes, so you can have coffee after, just wait about an hour, and then when you do drink it, make sure it's lukewarm.
Okay, absolutely. The other question is, do I have to take antibiotics?
Not everyone will have to take antibiotics. If there's an infection present, we will prescribe antibiotics, or at the discretion of your dentist. So not everyone will need them every time.
With today's modern procedures, extractions are actually most comfortable and complication-free.
Yes. But as always, if you are concerned about your condition after the surgery, do not hesitate to give our office a call. Thank you.